Welcome back to Hometown. February is National Heart Health Month, a time to focus on everyone's cardiovascular health. According to the CDC, one person dies every 36 seconds in the United States from heart disease. Dr. Ihamar Akabu, a cardiologist at Robert Wood Johnson Medical School, says there are many risk factors in developing heart disease. But despite these challenges, there are steps you can take towards prevention. Here is our exclusive interview with Dr. Ihamar Akabu.
Pretty much anybody can unfortunately be affected by cardiovascular disease. Cardiovascular disease is very common. In fact, it is the leading cause of death in this country and actually the entire world. So we need to be aware of our cardiovascular risk factors.
Can you specify some of those risk factors?
So even though cardiovascular disease is very common and unfortunately the number one cause of death in this country, we know what the major risk factors for cardiovascular disease are. So the way I like to break it down is using the American Heart Association, something called the Life Simple 7. And it basically breaks it down into basic categories that most people can understand. So some of those major risk factors are high blood pressure, your blood sugar or diabetes, your cholesterol, making sure you have a healthy weight, not smoking, and that's including both smokeless tobacco products and cigarettes as we know them, and making sure we stay active. And also keeping a healthy diet. So those are the 7 factors that we really put a focus on because they're all under people's control.
And what are some things we can do to help mitigate some of those risk factors?
If your viewers leave with anything from this segment, there's 2 words: awareness and prevention. So the first thing is to be aware. So let's look at high blood pressure, for example. So what is high blood pressure? It's very, very common. Nearly 50% of adults in this country have high blood pressure. But we need to understand what a high blood pressure is. So a normal pressure, let's say if you go get your blood pressure checked at your doctor's office or at the pharmacy, you get a top number and a bottom number. Below 120 top number and below 80 bottom number is a normal blood pressure. When somebody's blood pressure is persistently above the top number above 130 or the bottom number above 80, that's high blood pressure. So the first thing is to know what high blood pressure is. So what's the problem with high blood pressure? Well, people, when their pressure is high, they don't feel anything. But the problem is not only your heart, but your other organs are working really hard against that pressure. And over time, those organs can get unhappy and you can get things like heart disease, including coronary artery disease, heart failure, kidney disease, all sorts of things. So the first thing is awareness. What do we do about it? The first thing is always lifestyle changes. And in a good majority of cases, people need some medication to help control the blood pressure.
Doctor, a lot of people are on high blood pressure medications, as we know. What are some of the options for someone that's on more than one?
So some people do require more blood pressure medication than others. So the first thing is, what lifestyle changes have we made in terms of keeping a healthy weight and being active? And that's always front line. The second thing is, though, there are actually a lot of blood pressure medication options. And sometimes certain blood pressure medications don't work for some people, and they might work better for others. So we can always make adjustments and find a regimen that works for most people. But like I said, first line is always going to be lifestyle changes. High salt diet, things like that can really cause problems with high blood pressure, make it really difficult to manage, despite no matter how much blood pressure medication you're on.
Doctor, when you were listing the risk factors, the first thing that came to my mind is how much of this is genetic and how much of this can you control?
That's a wonderful question. There is definitely an environmental and genetic sort of interaction in terms of people's risk factors. So people can have a family history of early coronary artery disease. So that's blockages in the arteries that feed the heart that can lead to heart attacks. People can have strong family histories of high blood pressure. The good thing is that in the vast majority of cases, despite these environmental factors and family history and things like that, there are things that we can all do to address these risk factors and reduce our risk of developing future cardiovascular disease. Major cardiovascular events like heart attacks and strokes and heart failure, we all are able to do something to reduce our risk.
Doctor, one more thing I wanted to bring awareness about is the chest pain. It's one of the universal signs, right, of chest discomfort or a heart attack.
One of the primary heart attack symptoms is chest pain. And that can be chest pain when you're trying to exert yourself or do some sort of exercise. So shoveling snow or walking. But that's not the only symptom. In some people, males and females, it can be shortness of breath. Some people, it can be, I can't do as much as the same activity I was doing. I can't do it as well. I'm getting tired faster. So we do know that in women, the presentation can be not typical per se, typical meaning like chest pain, but also in men, we all need to be aware of the different symptoms that can be a manifestation of having underlying coronary artery disease. So what I would emphasize is if you feel like something is off, especially right now during the pandemic, when unfortunately a lot of people are not going to see their health providers, they're not going to the hospital because they're scared, and that's completely understandable. But what we're seeing in the hospital side is that people are coming in really late with symptoms of diseases that if they're caught earlier, you can do so much better. So I encourage people to be aware. And if you have any symptoms that are concerned to you, definitely go see your doctor. And anything severe, you definitely need to seek urgent care.
And doctor, in the moment when somebody's having a heart attack, what can we do immediately? You know, we hear a lot about taking an aspirin. How accurate is that, and what does the data show?
Sure. So what the data shows, and we have a huge amount of data, we're talking about decades worth of data, and this goes for stroke too. The sooner you get to care, the better you do. And so what happens with a heart attack is that one of the arteries to your heart gets blocked all of a sudden. One of the cholesterol plaques in the artery can break open and block the vessel. So the faster you get to be seen, the faster that blockage can be opened. So things like taking an aspirin in the setting of having a heart attack, things like that, those things can definitely help. But the main thing I have to emphasize is if you feel like something is wrong, and you're having chest pain or shortness of breath, or in terms of stroke, other symptoms like you can't speak all of a sudden, or you can't move one side of your body, you need to call the emergency EMS or go to the ER, because the faster you get to care, the better you do. We have so many interventions and therapeutics now that there's no reason why the vast majority of people can't be helped.
And doctor, at what point should one see a cardiologist for further diagnosis?
Sure, that's a great question. So cardiologists, there's a lot of different types of cardiologists, but we specialize in cardiovascular disease. But that doesn't mean that you have to wait to have cardiovascular disease to see a cardiologist. So cardiologists like me, for example, we do preventive cardiology. And so we can assess people's risk and decide if anything needs to be done or any testing needs to be done or interventions to reduce that person's risk of developing cardiovascular disease like a heart attack or stroke or heart failure, and evaluating the person. So what I would say up front is everybody needs a primary care doctor. Everybody needs a primary care doctor. That's front line in terms of prevention. But you also, if you're interested in your overall cardiovascular health and you have a primary care doctor, there's no harm in checking in with a general cardiologist and getting your heart checked out.
And finally, doctor, besides the lifestyle changes, can you outline the steps about maintaining a healthy heart?
Absolutely. The emphasis should be on what steps can I take to improve my cardiovascular health? So steps, not everything at once, right? So the first thing, again, is awareness in order to help with prevention, okay? So I encourage everybody to go to the American Heart Association website and look up the Life Simple 7. That's a good place to start. But in terms of simple steps that people can take, what are simple things that we can do right now? So the first thing that I mentioned, for example, be aware of what your blood pressure is, okay? Be aware of what a heart healthy or cardiovascular healthy diet is, okay? So one of the first steps somebody can take is begin to look at nutrition labels. So anytime I go to the supermarket, if I'm picking up something I've never picked up before, I turn the nutrition label around and I look and see what's there. How much fat is there? What type of fats? There's certain fats that are not so good for you, like saturated fats, trans fats, some of these things you might have heard about in the news. How much salt or sodium is there? Getting used to doing that can provide you the steps. And finally, I'd like to say that we all need to stay active. And so if we look at the guidelines, they would say at least 150 minutes of moderate intensity exercise a week or 70 minutes of high intensity exercise. So what's moderate intensity exercise? That means that if you're exercising and I call you on your phone, you shouldn't be able to have a full conversation with me. You should be, sort of working and getting your heart rate up. But I don't want people to hear those numbers and feel discouraged. Some of the greatest benefit that somebody can get can be going from being sedentary or not doing very much exercise and starting to get some routine activity. So even something like walking 30 minutes for 3 times a week can get you tremendous cardiovascular benefit if you're not that active. And so that's what I mean by starting somewhere. So I encourage everybody to begin to take the steps. And over time, I promise, if you take those steps, you can improve your cardiovascular health and reduce the risk of you developing future cardiovascular disease.
Great. Doctor, we're going to leave it there. Thank you for joining us today.
All right. Thank you so much for inviting me.
That was Dr. Ihimar Akabu, cardiologist and assistant professor of medicine at Rutgers University. Hometown will be right back.